Zuber Sultana is the clinical lead midwife and in antenatal service at Fernandez Hospital, Hyderabad, India, with 28 years of experience in maternal and neonatal health. She specializes in labor and delivery management, high-risk obstetric care, and postnatal support. Zuber also has extensive experience in leading labor wards, managing obstetric emergency, and delivering safe, compassionate, evidence-based care to mothers and newborns. Pothuraju Anitha, the second speaker, is the acting head of midwifery at Fernandez Hospital, Hyderabad, India, with over 26 years of experience in clinical practice, academic leadership, and midwifery education. She specializes in woman-centered midwifery care, antenatal and intrapregnant support, natural pain relief techniques, and respectful maternity care. Anitha is passionate about promoting quality evidence-based practice and advancing midwifery education at national and international level. Welcome here, Anitha and Zuber. Without further ado, I'd like to hand over the session to our distinguished speakers. Anitha and Zuber, please, the floor is yours.
Thank you. Thank you, Indriana. We'll just share the screen. Thank you, Indriana, for your introduction. I feel really honored to be on this platform on behalf of Fernandez Hospitals. Our topic is Scaling Midwife-Led Care in India, Evidence from Fernandez Hospitals and Government Collaborations. Fernandez Hospital was born in 1948 as a small two-bed hospital. From the beginning, we have focused on safe and respectful care for women. For more than 75 years, obstetricians have supported women through childbirth and built a strong foundation of trust and quality care. In August 2011, we introduced professional midwifery services. This was an important step in improving maternity care. Our teams work closely together so that women receive continuous support during pregnancy and childbirth. In 2017, we partnered with the government of Telangana and UNICEF to train 30 nurses as midwives. This pilot program was successful. It contributed to the Government of India launching a national framework in 2019, strengthen midwifery across country. In the same year, Fernandez Hospital was recognized as first National Midwifery Training Institute. With support from the World Health Organization, we started our first national midwifery educator training program to help improve midwifery education in India. Professional midwifery education and training is an in-house program initiated in 2011, designed in alignment with the International Confederation of Midwives competencies. Since its inception, 57 nurses have undertaken this advanced midwifery training. At present, 26 midwives are actively working at Fernandez while others have moved on for various reasons. Currently, 12 trainees are in their internship phase, preparing to transition into full professional roles. This program continues to strengthen midwifery practices by building a cadre of highly skilled professionals who are equipped to provide respectful, evidence-based midwifery care. The first cohort of midwives were all intrapartum nurses working in the labor room with a prior qualification in general nursing and midwifery or BSc nursing. One candidate entered with an A&M background. Each of them successfully completed the program and they have pursued further studies to become an outstanding midwifery leader. In 2017, the Telangana government, with the support of Fernandez, launched its first midwifery program, beginning with a batch of 30 staff nurses. Our team actively participated in training and capacity building for this pioneering group. Since then, we have supported the training of 353 staff nurses as nurse practitioner midwives and uh, two batches, that is 22 of midwifery educators. The trained midwives have been successfully placed across diverse healthcare settings, including primary health centers. These midwives now stand as the voice of women, delivering evidence-based and respectful maternity care. Their presence has strengthened maternal health services, empowered women, and advanced the professionalization in midwifery in the state. The nurses enrolled in the program were distinguished by their midwifery uniforms, symbolizing their transition from general nursing into specialized midwifery practice. During training, they worked with a structured curriculum and clinical settings, gaining hands-on experience and a professional identity as midwives. This picture captures the historic inauguration of the first nurse practitioner midwifery educator program in India held at Fernandez. To ensure the highest standard of teaching and mentoring, 6 international midwifery educators were deployed to guide the participants. There were 30 midwifery educator trainees deputed from 5 different states of India who successfully completed their program. The event marked a significant milestone in advancing professional midwifery education in the country, laying the foundation for a cadre of educators who would go on to strengthen midwifery practice and leadership across India. The Fernandez School of Nursing National Midwifery Training Institute is the first of its kind in India, established with the vision of advancing professional midwifery education. Since its inception, the institute has consistently upheld the highest standard of quality and excellence, aligning its curriculum with the international benchmarks and the competencies set by the International Confederation of Midwives. The Government of India launched its official midwifery guidelines at the end of 2018, marking a landmark step in strengthening maternal and newborn health services across the country. The initiative laid the foundation for scaling up midwifery in India, ensuring that women receive evidence-based, respectful, and women-centered care across diverse healthcare settings. These photographs capture the midwifery training sessions, showcasing nurses in their dedicated midwifery uniforms as they undergo structured education and hands-on clinical practice. The image reflects the commitment, discipline, and transformation of nurses into professional midwives, highlighting both the academic rigor and the supportive mentor environment that defines the program. In Telangana, we have the first batch of midwifery educator training in September 2020. This was a group of 11 MSc nurses, a mixed bag of tutors, and some with clinical experience. The online classes helped us complete 98% of the theory, most of it focused on the philosophy of midwifery care, respectful maternity care, and the normalcy of pregnancy, labor, and childbirth. The simulation was facilitated as mom's workshop for management of obstetrical emergencies in order to enhance the skills of the midwifery learners. The workshop focused on management of obstetrical emergencies such as postpartum hemorrhage, preeclampsia, breech birth, shoulder dystocia, and newborn resuscitation. Along with clinical skills, the sessions emphasized key human factors including communication, leadership, situational awareness, decision making, and effective teamwork. Through realistic simulation scenarios, participants strengthened their technical competencies and built confidence in managing high pressure situations safely and collaboratively. Thank you all. Now, Zubair will continue the presentation.
Thank you, Anitha. Greeting of the day to all who are present here. In 2019, Fernandez Hospital inaugurated the first midwife-led care unit in India. This pioneering initiative marked as a significant milestone in advancing respectful, evidence-based maternity care, placing midwives at the front of maternal health services. The MLCU provides women with a supportive environment where midwives lead care during normal pregnancies and childbirth, ensuring safety, dignity, and personalized attention. Its establishment has set a benchmark for integrating midwifery into mainstream healthcare in India. Our MLU is a co-located unit in BG, guided by a holistic, women-centered philosophy of care. It has a separate entrance to create a distinct, supportive environment. We have clear eligibility criteria for women to give birth in the MLU. And our midwives support women in the both MLU and OBU areas. We review our data weekly to identify areas for improvement and ensure we continue to provide the best possible care. A birth environment in the midwife-led unit is designed to support a safe, positive, and empowering experience for women. It ensures privacy, a calm and quiet atmosphere, and access to affirmation or relaxation videos. Women have a range of comfort measures available, including the affirmation or relaxation videos. Women have a range of comfort measures available, including the birthing ball, rebozo techniques, aromatherapy, massage, and the option for a warm shower, hydrotherapy, or waterbirth. We also provide food and fluids during labor to maintain energy and comfort. A companion of woman's choice is always welcomed, and the team consistently respect the woman's preferences and choices throughout labor and birth. Since its inception, the Midwife-Led Unit at Fernandez has supported 2,262 low-risk women. Of these, 68% successfully birthed within the MLU, while 32% were transferred to other units due to various clinical or personal reasons. This outcome highlights both the effectiveness of midwifery-led care for the majority of low-risk women and the safety of having clear referral pathways when additional support is required. Approximately 45% of women were transferred from the midwife-led unit to the obstetric unit as they preferred epidural analgesia for pain relief. This was despite the availability of a range of natural pain management options such as massage, warm shower, music, aromatherapy, affirmations, and hydrotherapy. These outcomes underscores the importance of respecting women's choice in childbirth. By honoring individual preferences, the MLU ensures that care remains women-centered, respectful, and supportive, while maintaining safe pathways for clinical interventions when desired. Among the women we supported in the midwife-led unit, 84% experienced spontaneous vaginal birth, reflecting the effectiveness of midwifery-led care in supporting natural childbirth. 19% assisted vaginal birth, ensuring safety while maintaining respectful care. Only 6% underwent cesarean section, highlighting the low intervention rates and the success of evidence-based practice in minimizing unnecessary surgical births. We also support women with alternative birthing positions, respecting their choice. This picture shows the number of births in different positions. We started our hydrotherapy and waterbirth services in 2017 at Fernandez Hospital. These are the hydrotherapy and waterbirth numbers for the last 3 years. Overall, we have had 427 waterbirths and 930 hydrotherapies. These services are used as a natural method of pain relief to support a gentle and comfortable birth experience for women. Research has also shared that this option may minimize the need for an epidural analgesia. So, our key message is simple. Integrating midwifery into healthcare system transforms maternal care and provides a sustainable pathway forward. Thank you all for listening to our presentation.
Patiently, we are open for your questions.
Okay, thank you for this insightful presentation, Anitha and Zuber. So the next agenda is discussion session. We are pleased to welcome you to ask questions or give us comments from the presentation. And I will read the comments before from Bupe. He said that beautiful color, pinks, like kindness, and it is encouraging to see that before implementation of the midwifery-led unit MLU, training of the midwives was undertaken. This is how implementation of MLU should be done. And thank you. Thank you, inspiring professor.
Thank you.
Thank you, Indriana.
No, Indriana.
Okay.
Is there anyone who want to raise your hand to ask the question directly to Zuber and Anitha, or want to just give the question in chat box? Just okay, Anitha, can I read the question from you? Have you been able to conduct process evaluation of how the implementation process is being undertaken? Anitha and Zuber can answer this.
I can't hear your. Can you see the question? Did you understand?
No. Your question is not clear, Indriana.
Your voice.
Your voice is not so
Oh,
clear.
really? Sorry. Okay.
Can we stop the screen share and check?
Okay. Sorry. Okay. Can you hear my voice right now?
Yes, we can hear you.
Okay, thank you. Okay, I will read the question from you. Have you been able to conduct process evaluation of how the implementation process is being undertaken? Anitha and Zuber. That's a question from Bupe.
Can I see the question, Indriana?
Yes, see.
Yes, you can see in the chat box.
Yeah, we are trying.
Okay. Last question.
Sorry.
From Sydney. with me. Oh, okay. Boop will ask directly. Yes. Please, Boop, you can just ask and open the camera or the microphone to directly to Anitha and Zuber.
Mute. Oh, okay. So, not sure if they did get my consent. So, when you implement a program in healthcare, it is very important to conduct process evaluation to check how the implementation process is being done. Midwives able to follow through everything else that needs to be followed when undertaking their work in a midwifery-led unit? That's the question. Thank you.
Thank you very much, Boo, for your question. Yes, we have set up an MLU guidelines and a protocol. There are pathways, and we have trained our midwives, all our in-house intrapartum nurses. Those who were chosen to be the midwives were given a dedicated midwifery program that is 18 months, equivalent to the ICM competencies. So they are well aware of all the guidelines, and we strictly follow the criteria for MLU admission. And all our midwives are aware of those, the criteria and the guidelines. Hope I've answered your question, Boop.
Okay, thank you, Anitha, for answering the question. Is there an answer yet? Boop? I think, yeah, it will answer, Anitha. Okay. Oh, no?
Yeah, implementation process is being undertaken. Okay, how the implementation process is being undertaken? It is with the conviction of Dr. Evita, the CEO of Fernandez organization, who actually understands the respectful maternity care and empathetic approach and evidence-based approach that the midwives follow in the countries abroad. And she was impressed, and she wanted to bring that philosophy into her settings for the women that enters into Fernandez Hospital to receive that. And that is how we started midwifery. And our as the leader is convinced and she has implemented, and all these doctors also have been oriented with the midwifery philosophy as the midwives are providing, and the women have been encouraged by the obstetricians actually to have the visit with the midwives here. So this is a private organization where all our obstetricians are very well convinced with the midwifery philosophy, and they have been convincing the mothers in order to take up the midwifery care.